Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Before we get into today's podcast topic, I just want to remind you to like and subscribe to the podcast if you have not already on whichever podcast platform you are listening on. And if you are able to leave a rating or leave a review, I would appreciate it so much. It really helps other people to be able to find the podcast and benefit from the content as well. All right, today we are going to be talking about chondromalacia. And this was actually inspired by a question that I got over social media from a dance teacher who sort of reached out and said, I have a dancer who's just been diagnosed with this. Help. I don't know what to do. I don't know what it is. You know, does this person need to stop dancing? How do we manage this? Kind of all of the things. Like, I think they'd probably just gotten the information from the parent that the dancer had been diagnosed with chondromalacia. So although this teacher did not specifically request me to do a podcast topic about it or a podcast episode, I decided that this was going to be the easiest way to answer this question. I did respond to her individually as well, but I thought it would be something that we could chat about on the podcast because if one teacher has this question, I am sure many, many more do. So we're going to talk about chondromalacia today, what it is, how we see it present in dancers, how we deal with it, all of the things. So chondromalacia is a term that refers to a specific process that's happening at the cartilage in the body. And so it sounds quite scary. Like, I think the teacher reaching out to me, their response to hearing this diagnosis was one of like a bit of anxiety and fear of like, this sounds really serious. Does this dancer need to stop? Like, is this going to cause long-term damage? Like, all of these things. But like I said, it's just a term that we use to describe a process that is happening within the cartilage. Specifically, it is sort of defined as softening or swelling and then potentially eventual breakdown of cartilage. Chondromalacia can happen in any area in the body where there is cartilage, but it most commonly happens in the knee and specifically on the underside of the kneecap or the underside of the patella. And so when we're using the term chondromalacia, most often we're talking about chondromalacia patella. It just gets shortened to that term, which is a bit misleading because, like I said, it can happen in other areas of the body as well. But if people are throwing this term around or it's being sort of diagnosed, it's almost always in relation to knee pain. So I'll talk specifically about how we see it present in the knee, but we'll also touch a little bit on how it presents or other areas of the body that we potentially see it present in dancers as well. So this softening or kind of breakdown of the cartilage occurs in stages, and we grade those. So sometimes we call them like grades and sometimes we call them stages. It's all the same thing. And they're graded from grade 1 to grade 4. And so in a grade 1, this is the most mild form of it, we're going to have, like I said, the softening of the cartilage that starts to happen. And there is generally swelling associated with that as well. So it's sort of that beginning stage. There's irritation that's happening in the cartilage. It's causing this softening and this swelling to occur. If this stage 1 is left untreated or continues to be kind of like irritated, it progresses to stage 2 or grade 2. And in that, we start to get kind of, it's like blister formations and early surface changes that happen to the cartilage. And so those surface changes are called fibrillations, but it's essentially just the surface of the cartilage starting to be a bit irregular. The easiest way to visualize it is almost like little like blistering kind of happening along the surface of that cartilage. Again, there's often swelling present as well. In a grade 3, we start to get what's called fissuring or even fragmentation of the cartilage. And so that fissuring is like imagine like little cracks starting to appear in it, or it's starting to have disruptions that are happening. And like I said, sometimes this leads to fragmentation. So sometimes we can get little like pieces of the cartilage that might kind of break off or create more issues in through there. And then we also start to see the cartilage thinning. So the actual cartilage layer itself starts to thin out a little bit. So there's just less cartilage in that area. Cartilage, for those of you who are maybe not aware, cartilage is a smooth lining that covers certain bones in our body, and its job is generally to decrease the amount of friction that's happening between bones or help with kind of shock absorption within bones. So the thinner the cartilage is, the less well it's able to do that job. And then in grade 4, so again, if this continues to progress, by the time we get to a grade 4 chondromalacia, this is when we actually start to see enough thinning that we start to see exposure of the subchondral bone underneath. So we actually start to see areas where the cartilage is maybe like worn away, and we get that exposure of the bone underneath. So like I said, these are sort of the 4 stages or 4 grades, but most of the cases of chondromalacia that we see in dancers, and especially if we're talking about younger dancers like adolescent dancers, but even dancers like professional dancers who tend to be on the younger side of things, we're generally seeing more of these early stages, like maybe a grade 1 or a grade 2. We don't often see the more advanced stages in younger populations. Those we are more likely to see in an older adult population. So that's not to say that we can't see them in dancers, but it's more likely that it's going to be in our older adult dance population, or potentially dancers who are retired who previously were, professional dancers or danced a lot or that type of thing. So, like I said, the patella, the kneecap, is the most common area that we see this in. And this actually falls under the umbrella of what we would classify as patellofemoral pain syndrome. So if you've been around and listening to the podcast for a while, you may remember way back in, I believe it was, let me just check, episode 59, I did an episode on patellofemoral pain syndrome, or PFPS. And patellofemoral pain syndrome, the easiest way to think about it is it's like an umbrella. And then there's a bunch of different things, like kind of conditions that fall under that umbrella. It's a bit of an umbrella terminology. And chondromalacia would be one of the things that falls under that umbrella of patellofemoral pain syndrome. So if you're interested in what other causes of kind of anterior knee pain or patellar pain could be, go back, listen to episode 59. I talk about all this stuff in like a lot of detail, and I will link that episode in the show notes. So if you're interested in that. But like I said, for chondromalacia, number 1 site we see it in is the patella, especially in younger dancers. Another area that we commonly will see it in is the hip joint. So the actual ball and socket part of the hip joint, the socket has cartilage lining in through there, and we can see chondromalacia start to develop in the hip as well. This commonly happens in association with femoral acetabular impingement. So if somebody has some sort of an impingement happening in the hip, that can cause some uneven wearing or uneven kind of irritation within the hip joint itself, and possibly lead to this chondromalacia. I have also done an entire podcast episode on femoral acetabular impingement, and I don't specifically refer or talk about chondromalacia in that episode, but we do talk about the common presentations of impingement and some of the cartilage damage that can occur. So again, if you're interested more in how this specifically affects the hip, go and listen to episode 86. I will also link that episode in the show notes. We can see chondromalacia happen, well, to be quite frank, we can see chondromalacia happen in any part of the body that has cartilage, essentially. So it can happen in any of these joint surfaces. But one of the other ones that is common, and maybe less so in dancers, I don't know that I've actually seen any dancers who have had it in their shoulder joint. However, there are other sports like throwing type sports or even overhead like volleyball and stuff like that where we might see it more commonly, but it can certainly occur in the shoulder joint. We just don't tend to see it as commonly because there is less repetitive movement of the shoulder or less weight-bearing movement. Now, I don't personally in my practice treat a lot of break dancers or those kind of styles where it is quite upper extremity heavy. And so we may see it more in those populations. But like I said, in my experience clinically, I'm not seeing a lot of chondromalacia in the shoulder joint, but it certainly can exist. And in other populations, it might be more common. And then the final area, which I actually do see I say a fair amount. I'm making it sound like it's really common. It's not as common as in the knee, but other cases that I have seen are in the ankle and specifically the talus. So the dome, the talar dome, we will sometimes see chondromalacia happen in that area in the body. And I'm going to talk a little bit about causes in a second in terms of like what causes chondromalacia to happen. And in the ankle specifically, this tends to be a result a little bit more of trauma. And so oftentimes it'll be somebody who's had a traumatic ankle injury, like an ankle sprain or something like that. And then they will develop this chondromalacia as a result of that, as opposed to the knee, for instance, where it tends to be much more of a repetitive overuse injury in the knee as opposed to it being a traumatic injury. So I suppose that is a good segue into talking about what causes chondromalacia. So number one, like I just alluded to or just said, it primarily happens from repetitive loading of a specific joint, and especially repetitive loading in potentially like non-optimal movement patterns. So in the case of the knee, we might have an issue with tracking in the knee, and that can be for a variety of reasons. It could be from like muscle imbalances around it. It can be from like poor neuromuscular control or poor movement patterns or things like that. But if we have a tracking issue happening, that repetitive loading with sort of poor mechanics or some sort of tracking issue can create irritation through the cartilage surface of the kneecap and kind of cause this chondromalacia to occur. We especially see it in high impact activities. So in dance, a lot of that repetitive jumping will be one of the reasons we see it. We see that commonly in like basketball players and other jumping sports as well, or just repetitive knee flexion moments. So if we think about like pliés and grand pliés or anything where we're doing repetitive squatting type motions, we will tend to see this as well. And essentially, these repetitive movements, like I just said, if we have kind of a tracking issue or any sort of imbalance, it just creates uneven wear in that cartilage. And so generally, we want to have fairly even wear across the entire cartilage surface. But if we have an imbalance that's happening, it's going to create more wear in one particular area of the cartilage and potentially less wear in the other part. So most of the cases of chondromalacia that we see are from repetitive overuse. But like I was mentioning, when it comes to the case of the ankle, and this can happen in other joints as well, absolutely, it can also be the result of trauma. And so that trauma can create, like sort of start off that process and then create that swelling and irritation on those cartilage surfaces. So repetitive overuse or sort of imbalances creating uneven wear across the cartilage surface is the number one reason we see it, but trauma can certainly play a role. And in the ankle, that has been my clinical experience, is that I have mostly seen it as a result of trauma in the ankle as opposed to just repetitive overuse in the ankle. Although in dancers who do a lot of work on releve or on point, we might actually see it from more repetitive overuse as well. But my clinical experience has been that it has been much more from traumatic injuries that have caused some damage to the cartilage. So in terms of symptoms, how does this present? Number one, people are going to have pain in the area. And when people come in, especially with chondromalacia patella, they will often describe the pain. If you kind of ask them, oh, where does your knee hurt? They will often describe it as like underneath my kneecap, or they'll be like inside my knee. Like it feels like it's coming from that underside or the undersurface of the kneecap. So pain is the number one thing that we see. We will often see swelling associated with it as well. So like I was saying, chondromalacia is just one of the things that would be classified under a patellofemoral pain syndrome kind of umbrella. And in a lot of the other conditions that we see, we may not have swelling associated with it. But if we're getting a lot of swelling around the knee, there's a good chance that there could be some of this chondromalacia happening. So we're going to have pain. We may have swelling associated. We might, if it's a hip or another area of the body, we might not see the swelling as much, but the ankle and the knee, we definitely will see the swelling. And then one of the other hallmark signs of chondromalacia is that we will often have what is termed crepitus, but essentially it's like a grinding or sort of a creaking, or the joints will be making noise when you move them. And so you can sometimes feel it under your hand. So say you have your hand on top of someone's kneecap, you can kind of feel it happening, or you can actually audibly hear it happening if it's loud enough or if it gets bad enough. So that grinding or crepitus is often associated with chondromalacia as well. In terms of diagnosis, it is diagnosed generally just with a physical exam. So either done by like a doctor or a physical therapist or whoever who has like the skills and the knowledge to diagnose it clinically. Most of the time we do not require imaging for it. It's like fairly common to be diagnosed just based on physical exam. But if they were going to do imaging, or if we feel like we need further imaging on it, generally we're going to get x-rays initially to look and see if there's any sign of changes in the bony surfaces, which would potentially indicate like a higher degree of chondromalacia. So if we have like a grade 1, that's generally not going to show up on an x-ray. But if it starts to get to the point where that cartilage is thinning or there's like subchondral bone being exposed, that is going to show up on an x-ray. Or sometimes MRI is used as well. And that would be maybe more if we're A, trying to rule out other things, but B, trying to figure out if it's maybe more of an early stage chondromalacia. We're more likely to see just that sort of softening and swelling happening on an MRI than we are on other imaging. But like I said, the vast majority of time, imaging is not required. This is going to be diagnosed in clinic with a physical exam from a knowledgeable professional. In terms of treatment, what do we do about these? Because I realized the term itself, just the name of this condition, it sounds scary. It sounds very, very serious. And that's not to like minimize the effect of it. It can be quite painful and it can be functionally fairly limiting to people. But the vast majority of cases respond really well to what we deem conservative treatment. So physical therapy, activity modifications, all of those types of things. That is first-line treatment, and the vast majority of people are going to respond well to that. If we have people who have really advanced stage, so we can get up into those like grade 4 level chondromalacia, and again, this is going to be in a much older adult population, they may be at the point where if they've tried conservative treatment and it's just not improving things enough, that then may indicate the need for more interventions, whether that be like injections or surgical interventions and things like that. But for the majority of our dancers, we are going to manage these conservatively. So what does that mean? Number one, activity modification. So we need to limit the activities or the movements that are the most irritating to the cartilage. So in the case of the knee, so if we have chondromalacia patella, the most irritating activities are going to be repetitive jumping, so hence the landing from the jumps generally. It's often going up and down stairs can be really irritating, and repetitive knee flexion, essentially, which is where the going up and down stairs comes from. But that repetitive knee flexion or loading into knee flexion, so plies or squats or lunges or things like that. So those are the movements that we need to modify. So say we'll take a plie as an example. we might have to say, okay, we're actually not doing any pliés right now, depending on how irritated it is. But a lot of the times we don't have to completely eliminate that, but we might limit the depth of the plié. So we're not doing grand pliés. You're only going to be doing demi pliés until it calms down. And then we start to add in more of those kind of more challenging activities. But activity modification, so that is going to look different depending on what part of the body we're dealing with, obviously, and then also the movements or the activities that are most irritating to that dancer. So it is not going to be the same for everyone, but we need to limit the movements that are the most irritating. Then we want to look at addressing any sort of imbalances that might be happening around that joint. So I'm just going to keep using the knee as an example because it is the most common one that we see. But what we will often see around the knee is that potentially there are some muscles that might be weaker than they should be. And really commonly for the knee, it might be like the hip abductors, abductors, or the hip external rotators, our turnout muscles. We might have some weakness in some of those. We sometimes just call them the hip stabilizer, lateral stabilizer muscles. We'll commonly see weaknesses in those muscles that can lead to some of this kind of like uneven loading through the cartilage or poor tracking. Another one I see really commonly in dancers is weakness in their adductor muscles, so hip adductors, which are our inner thigh muscles. And so sometimes those are the muscles we need to look at addressing. This can be related to muscles that are overly tight. And so sometimes our lateral quad might be too tight. Sometimes our adductors are actually tight as well. Sometimes they're tight because they're weak. All of that to say, we want to look at any of the imbalances around that joint that could potentially be contributing to this uneven wear. Again, I talk about this a lot more in the specific episodes on patellofemoral pain syndrome and femoral acetabular impingement. I talk a lot more specifically about like each of those joints. So if you want to know, specifically, for the hip joint, what we do, go back and listen to that episode. I'm not going to dive into it in too much depth today, other than to say we really want to look at addressing any imbalances that exist around the joints that are being affected by the chondromalacia. And then we really want to look at technique. And so again, if this is the knee, really looking at tracking of the knee, and especially tracking of the knee with landing from like jumps or bigger, more dynamic movements. How well are they able to control that? Where is the knee tracking? The same is true for like the ankle or the hip or things like that. We want to look at any technique issues because, like we talked about, this generally occurs because of repetitive movements that are causing uneven wear on the cartilage surfaces. And so if there's something we're doing in our technique that is causing that to happen, we need to look at addressing that so that we can kind of break that cycle and prevent that from happening. So that's really looking at alignment and then really looking at like the technical skills. In terms of other treatments, people always ask about, like ice or anti-inflammatory medications and all of those types of things. And this is going to be a little bit individual to the person. Generally, ice is not recommended anymore when it comes to kind of swelling and inflammation. However, it can still be really effective from a pain control perspective, just as an analgesic. So it's not to say we're never going to ever use ice, but it's not always our first line of treatment. And if we are using it, we're generally using it from a pain management perspective. And similarly, anti-inflammatories are generally not recommended in these types of conditions. If we need pain management, we're going to be looking much more at just like an analgesic, not necessarily an anti-inflammatory, because the anti-inflammatories have been shown to maybe disrupt a little bit of the body's natural healing process. And with these types of sort of more, I'm going to call them like an overuse type condition, that is often not required to be using like an anti-inflammatory type medication. But again, that is going to be really, really individual, and that is something to discuss with your healthcare provider, like personally, because there are instances where those actually may be indicated. But across the board for treatment options, it's activity modification, addressing imbalances that might exist, and then really looking at alignment and technique to make sure that we're not, having issues with uneven wear across the joint surfaces. All right. I think that's all I have to say on this issue. Hopefully that clears things up for some people. Like I said, I think that this word, if people are getting told that they have this diagnosis from like a doctor or something like that, it does sound scary and does feel like it holds a lot of weight. But hopefully that is a bit reassuring that this is something that we very commonly see, and it is very successfully treated with conservative treatment. And it is probably like one of the biggest conditions that we see fall under that patellofemoral pain syndrome umbrella. So if you've dealt with knee pain and you've been told, oh, this is like patellofemoral pain syndrome, chances are, or I shouldn't say chances are, there is a chance that what you're dealing with could have been chondromalacia. And so it is by no means something that is really serious diagnosis in the sense that we need to like stop dancing or it's going to shorten a dance career or anything like that. But it is something we want to address because it can progress from that grade 1 up into that grade 4. And we want to address it at the earliest stage possible with those activity modifications and technique things and stuff so that it does not get more severe. So hopefully that clears up any questions that anybody had, or you just learned something new about cartilage in the body today. If you have further questions, please reach out. Let me know. You can reach me on all the social media channels at dancephysioerica with a K, or send me an email. My email is in the show notes. Thank you so much for listening, and I hope you have a great rest of your day.